Hi everyone, this is Ophelia and I trust that everyone is doing great today. My topic of choice for today is prostate and prostate cancer. And I chose this topic so that those men out there who are anxious about getting a check will be more informed and make the decision whether or not they need to have a check of their prostate gland and to check for changes within the gland. And for today's topic, the prostate gland, the prostate cancer. Firstly, I want to say that the prostate is located under the bladder, and it has two functions. Well, two of its functions include controlling the flow of urine by the use of its muscle fibers, and also to produce a protein called PSA, or prostate specific antigen, which keeps semen in its liquid form. And we know, as men and women, we know that semen contains sperms, and that's what keeps them alive, and sperms are useful for reproduction. So the PSA helps to keep the semen in its liquid form. And however, some of this PSA might escape into the bloodstream, and so when you go to the doctor, if you need to do a PSA, it will be normal to find some PSA in the blood, because sometimes some of it escape into the bloodstream. And therefore a blood sample is what is taken if you want to do a PSA. If the levels are high, it might be indicative of a prostate cancer, or that something is wrong within the prostate gland. According to my sources, it is a myth to think a high blood PSA is harmful. However, it might be an indication that something may be wrong in the prostate, because other things such as medications that are used to increase hormone levels might affect the amount of PSA in levels in the blood. And according to one article that I read, every year approximately 209,000 people, 209,000 people per year, men per year, of all races, are diagnosed with prostate cancer, and it is one of the leading causes of cancer in the US among all races. And then it's saying some people may die of old age without knowing that they have prostate cancer, because it progresses slowly. And signs and symptoms of prostate cancer, you might find, as a man, you may find that you pass urine more frequently. You might be getting up more frequently in the night to urinate. You might find that it's hard to start urinating, so when you go to the toilet, it might take a while before you start actually passing urine, even if you feel like you want to urinate. Blood may be present in the urine, and the urination may be painful. You might have pain when you are ejaculating, but according to the sources, this is less common. And you might have problems not maintaining or having less erections. And those are in the early stages according to my research. And in the advanced stages, you might have bone pain, whether it's in the spine, the pelvis, or the ribs. Might have weakness in the legs, And this is if the cancer has spread to the spinal cord and is squeezing on the spinal cord. Urinary incontinence might be another problem. Remember how I said that the prostate gland has muscle fibers that control the flow of urine, so those might become affected, and you might find that you have incontinence and not able to control when you want to urinate, so you might wet yourself. And you might also have fecal incontinence, where you pass stool, you're unable to keep your stool. You pass stool without being able to prevent yourself from doing so. And so if you have one of these problems, it does not necessarily mean that you have cancer. If you have a combination of symptoms, instead of worrying, just check out your doctor, to have a talk with your doctor, and they will advise you and as to what the next step will be. So that's just the general signs and symptoms. The causes of cancer. The cause of cancer, according to research, no one is really sure, but there are possible factors which include the age of the person. In terms of age, they're saying the older a man is, the higher the risk of developing cancer. But under the age of 45, it is less common. So it's rare under the age of 45, more common after age 50. And you might have genes. It's more common among African Americans than in white Americans. And in terms of family, if you're a twin and your twin has prostate cancer, it is more likely that you will develop prostate cancer. If your brother or your father, a close relative, had prostate cancer, it is more likely that you will develop cancer. So these are some of the in terms of genes and age. If you have concerns, if somebody for you, close relative, has cancer, instead of sitting and worrying about it, I'd advise you to have a medical checkup, talk to your doctor, because according to my sources, if you are high risk, and high risk is for those persons who, in terms of the age and the family genes, in terms of someone in the family having cancer, like a brother or father, then you might want to, you're at higher risk, so you might want to have a check. Even if you don't have any signs and symptoms, just talk to your doctor and they will advise you. Diet is another factor that might cause prostate cancer. They're saying a diet high in vegetables. So a healthy diet can decrease your chances of getting prostate cancer or any form of cancer. A diet high in red meat increases your chances of getting cancer. And if you have prostate cancer, you might find that processed foods and diet high in fat actually causes the cancer to progress more quickly. So also, if you are low in vitamin D, which is a vitamin that you can get from sunlight, it's also available in supplements, but sunlight, according to my research, just leave 15 minutes a day in the sun gives you enough vitamin D for the day. So but you can do your check on that and see how much vitamin D you need. and ensure that you get your vitamin D, because it's free. If you're in a part where the sun shines, it's free. If not, you might want to do a checkup and have the doctor, if you have deficient vitamin C levels, then the doctor might prescribe some supplements of vitamin D if it's not possible for you to get it from the sun. Medications such as those given for high cholesterol may increase the chance of prostate cancer. Obesity, and we know that being overweight is a risk for a number of conditions, and so it's a risk for developing prostate cancer. So this is where you might start your exercising, making sure that you start getting you into shape. Even if you don't see immediate results, the very fact that you've started is going to help decrease your chances of getting cancer. Sexually transmitted diseases, according to one study, for example, gonorrhea. A person who has had gonorrhea might have an increased chance of getting prostate cancer. And so what do you do in terms of a medical? If you have any concerns, or if you are high risk, age 40 and above, and have family who has had or who have at present have prostate cancer, you might want to have a checkup. And there are specific tests that are done, which I would not go into, except for the digital exam, which is performed by manually inserting a finger into the rectum and searching for irregularities in terms of the shape and the size of the prostate. It's a simple procedure. However, some men have concerns concerning this. So, but I'm telling you, I've seen it done. I have not experienced it, but I've seen it done, and it's not painful, and it's not as costly as the other tests. And from there, if you have the digital rectal examination done, from there your doctor can advise you. So my topic today, I hope that it has helped you in some way or the other. And until next time, I want to encourage you to take responsibility for your own health. Do not depend on cure, but start taking preventative measures so that you can reduce your risk of not only prostate cancer, but other diseases which are likely caused by your lifestyle, whether it's a diet and also exercise. So that's all for today. Until next time, remember, if you like this video, to share with someone who may need the information. Also subscribe if you're viewing on YouTube. If not, you're on Facebook or any other social media platform, feel free to share it with someone. And remember to visit my website, cupidandi.com, where I have more helpful articles for you, and my fan page, cupidandi.com, motivational blogs and poems. Until next time, remember, positive energy always. Bye.